Question 1. Consider a scenario where a certified sex offender treatment provider, CSOTP, has been working with a particularly challenging caseload for over a year, involving multiple clients with severe histories of abuse and aggression. The CSOTP is beginning to experience increased irritability, difficulty concentrating during sessions, and a general sense of emotional exhaustion. Which of the following actions best represents a proactive and ethically sound approach to prevent burnout and maintain professional effectiveness? Option A. Schedule regular, formal supervision sessions with a qualified supervisor experienced in trauma-informed care and sex offender treatment to process challenging cases, discuss ethical dilemmas, and receive guidance on managing emotional impact. Option B. Minimize the emotional impact of client narratives by focusing strictly on behavioral interventions and avoiding deep dives into the client's personal histories. Option C. Rely on informal discussions with colleagues during lunch breaks to share frustrations and seek advice on managing difficult clients. Option D. Increase the frequency of personal recreational activities, such as hiking and social gatherings, to distress and distract from the demanding nature of the work. The correct answer is A. Schedule regular, formal supervision sessions with a qualified supervisor experienced in trauma-informed care and sex offender treatment to process challenging cases, discuss ethical dilemmas, and receive guidance on managing emotional impact. Explanation. Scenario analysis. This scenario presents a common yet critical challenge for certified sex offender treatment providers, CSOTP. The risk of vicarious trauma and burnout, the constant exposure to traumatic narratives, the emotional intensity of therapeutic work, and the demanding nature of managing caseloads can significantly impact a CSOTP well-being. Failure to address these issues can lead to diminished therapeutic effectiveness, impaired judgment, and potential harm to clients, as well as personal distress for the provider. Professional judgment is required to balance the demands of the profession with the necessity of maintaining personal resilience and ethical practice. Correct approach analysis. Prioritizing regular scheduled supervision with a qualified supervisor who specializes in trauma-informed care and sex offender treatment is the best professional practice. This approach directly addresses the need for emotional processing, skill development, and ethical guidance in a confidential and supportive environment. Regulatory frameworks for CSOTP, such as those often found in state licensing boards or professional association guidelines, emphasize the importance of ongoing professional development and support to ensure competent and ethical practice. This includes seeking supervision to manage the psychological impact of the work, thereby preventing burnout and maintaining objectivity and efficacy in treatment. This aligns with ethical principles of self-care and professional responsibility to clients. Incorrect approaches analysis. Minimizing the impact of client trauma and believing one can manage it independently without external support represents a significant ethical failure. It disregards the well-documented psychological toll of working with sexually traumatized individuals and can lead to impaired judgment and ineffective treatment. This approach violates the implicit ethical duty to maintain one's own professional capacity, which is essential for client safety and well-being. Relying solely on informal peer discussions without structured supervision is also professionally inadequate. Peer support can be valuable. It lacks the formal accountability, specialized expertise, and objective perspective that a qualified supervisor provides. Informal discussions may not adequately address complex ethical dilemmas or the deep emotional impact of vicarious trauma, potentially leading to the reinforcement of maladaptive coping mechanisms or a failure to identify critical issues. This can be seen as a deviation from best practices in professional development and ethical oversight. Engaging in recreational activities without addressing the underlying emotional and psychological stressors of the work is insufficient for burnout prevention. While leisure is important for general well-being, it does not provide the targeted support needed to process vicarious trauma, manage countertransference, or navigate the ethical complexities inherent in sex offender treatment. This approach treats the symptom stress, rather than the root cause, vicarious trauma and professional demands, failing to meet the comprehensive self-care requirements for sustained ethical practice. Professional reasoning. Professionals in this field should adopt a proactive and structured approach to self-care. This involves recognizing the inherent risks of vicarious trauma and burnout and integrating regular, formal supervision into their practice. A decision-making framework should include 1. Self-assessment. regularly evaluating one's emotional and psychological state. 2. Seeking appropriate support, actively engaging in supervision, consultation, and potentially personal therapy. 3. Skill development, continuously learning and applying evidence-based self-care strategies. 4. Ethical adherence, understanding and applying ethical codes that mandate self-care as a prerequisite for competent practice. This systematic approach ensures that the provider's well-being is maintained, thereby safeguarding the quality of care provided to clients. Question 2. The investigation demonstrates that a certified sex offender treatment provider is evaluating a client for treatment readiness and risk level. The provider is considering which assessment techniques to employ. Which of the following approaches would best align with current professional standards and regulatory expectations for a CSOT? Option A. An assessment relying heavily on unstructured interviews to explore the client's narrative, with minimal use of standardized tools or collateral data. Option B. An assessment focused solely on static risk factors such as prior convictions and demographic information to determine future risk. Option C. A comprehensive assessment integrating validated risk assessment instruments, structured clinical interviews, collateral information, and psychometric testing. Option D. An assessment primarily based on the client's self-reported feelings of remorse and desire to change, without further objective verification. The correct answer is C. A comprehensive assessment integrating validated risk assessment instruments, structured clinical interviews, collateral information, and psychometric testing. Explanation: scenario analysis. This scenario presents a professional challenge due to the inherent complexity of assessing individuals with a history of sexual offenses. The CSOT must navigate the dual demands of ensuring public safety while also facilitating effective treatment. The challenge lies in selecting assessment techniques that are both scientifically sound and ethically appropriate, considering the potential for manipulation by the client and the need for objective, evidence-based conclusions. The CSOT judgment is critical in distinguishing genuine progress from superficial compliance. Correct approach analysis. The correct approach involves a multimodal assessment strategy that integrates various data sources. This aligns with best practices in forensic psychology and sex offender treatment, emphasizing the need for a comprehensive understanding of the individual. Utilizing validated risk assessment instruments, e.g., Static 99R, SORAG, provides objective measures of static risk factors. Clinical interviews, structured and semi-structured, allow for the exploration of dynamic risk factors, cognitive distortions, and treatment readiness. Collateral information from probation officers, parole agents, or previous treatment providers offers crucial corroboration and context. Psychometric testing can further elucidate personality traits, cognitive functioning, and potential co-occurring mental health conditions. This integrated approach ensures that the assessment is robust, reliable, and directly informs treatment planning and risk management strategies, adhering to the ethical obligation to provide competent and evidence-based care, as expected of a certified sex offender treatment provider. Incorrect approaches analysis. Relying solely on self-report without corroboration is a significant ethical and professional failure. Sex offenders may present with sophisticated manipulation skills, leading to inaccurate self-assessments that do not reflect actual risk or treatment needs. This approach violates the principle of due diligence and can compromise public safety. Focusing exclusively on static risk factors, while important, neglects the dynamic factors that are amenable to change through treatment. This can lead to a static view of the individual, failing to identify opportunities for intervention and rehabilitation, and thus not fulfilling the comprehensive assessment requirements for effective treatment planning. Prioritizing only the client's stated desire for treatment without objective verification of progress or underlying risk factors is also professionally unsound. While motivation is a component, it must be assessed in conjunction with other factors. This approach risks misinterpreting superficial compliance as genuine change, potentially leading to premature or inappropriate treatment conclusions. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements for CSOTP certification and practice within the relevant jurisdiction. This includes familiarizing oneself with mandated assessment tools and ethical guidelines. The process should then involve 1. Identifying the purpose of the assessment, e.g., initial evaluation, treatment progress, risk reassessment. 2. Selecting a battery of assessment tools that are validated for the population and purpose, ensuring a mix of static and dynamic risk factors, and incorporating multiple data sources. 3. Conducting the assessment in a manner that is both clinically sound and ethically responsible, maintaining objectivity and awareness of potential manipulation. 4. Synthesizing all gathered information to form a comprehensive picture, which then informs treatment planning. Risk management and reporting. This systematic and evidence-based approach ensures that decisions are defensible, ethical, and contribute to both individual rehabilitation and community safety. Question 3. Upon reviewing the case file of a client with a history of child sexual abuse offenses, a certified sex offender treatment provider, CSOT, is tasked with developing an initial treatment approach. The client presents with a complex history including early childhood trauma, significant cognitive distortions related to entitlement, and a pattern of impulsive behavior. Considering the diverse potential contributing factors to sexual offending, which of the following represents the most appropriate theoretical foundation for guiding the initial assessment and treatment planning? Option A. A singular focus on cognitive behavioral theory, emphasizing the identification and modification of distorted thinking patterns as the primary driver of the offending behavior. Option B. A purely risk-need responsivity, RNR, model, focusing exclusively on identifying static and dynamic risk factors and matching interventions solely to those factors without deep theoretical exploration. Option C. An integrated approach that draws upon multiple theoretical perspectives, such as attachment theory, cognitive behavioral theory, and social learning theory, to understand the interplay of various factors. Option D. A psychodynamic approach that prioritizes exploring early childhood experiences and unconscious conflicts as the sole explanation for the sexual offending. The correct answer is C. An integrated approach that draws upon multiple theoretical perspectives, such as attachment theory, cognitive behavioral theory, and social learning theory, to understand the interplay of various factors. Explanation. This scenario presents a common challenge in sex offender treatment, applying theoretical frameworks to complex individual cases while adhering to professional standards and ethical guidelines. The challenge lies in moving beyond a singular theoretical lens to a more integrated and evidence-based approach that considers the multifaceted nature of sexual offending. The correct approach represents best professional practice because it acknowledges the limitations of any single theory and advocates for an integrated understanding. This aligns with the principles of evidence-based practice, which emphasize the use of intervention and theoretical frameworks supported by research. A certified sex offender treatment provider, CSOT, is expected to possess a broad knowledge base of various theories and to apply them judiciously, recognizing that no single theory explains all cases. This approach promotes a comprehensive assessment and treatment plan tailored to the individual's specific needs, risk factors, and developmental history, which is a cornerstone of ethical and effective treatment. An incorrect approach that relies solely on a single theoretical model, such as a purely cognitive behavioral or psychodynamic perspective, fails to account for the diverse etiologies of sexual offending. This can lead to incomplete assessments and ineffective treatment plans. Ethically, this represents a failure to provide comprehensive care and may violate professional standards that require a thorough understanding of the relevant literature and best practices. For instance, exclusively focusing on cognitive distortions without addressing potential underlying attachment issues or trauma would be a significant oversight. Similarly, a purely psychodynamic approach might neglect the practical, skill-building components often crucial for relapse prevention. Another incorrect approach might involve dismissing the relevance of theoretical frameworks altogether, opting for a purely pragmatic or common-sense approach. This is professionally unacceptable, as it bypasses the foundational knowledge and research that inform effective treatment. It demonstrates a lack of professional development and an inability to critically evaluate and apply established principles. This can lead to treatment that is not evidence-based, potentially ineffective, and may even be harmful by not addressing core issues identified through theoretical understanding. The professional reasoning process for navigating such situations involves a continuous cycle of assessment, theoretical integration, intervention, and evaluation. Professionals should first conduct a thorough biopsychosocial assessment, drawing upon various theoretical perspectives to inform their understanding of the offender's history, motivations, and risk factors. They should then critically evaluate the strengths and limitations of different theoretical models in relation to the individual case. Treatment plans should be developed collaboratively, integrating evidence-based interventions that are informed by the chosen theoretical framework. Ongoing monitoring and evaluation of treatment progress are essential, with adjustments made as needed based on the individual's response and evolving understanding. This iterative process ensures that treatment remains relevant, effective, and ethically sound. Question 4. The performance metrics show that a client has consistently engaged in treatment, demonstrating significant improvements in their cognitive distortions and emotional regulation skills, which are dynamic risk factors. However, the client's static risk assessment score remains high due to the nature of their past offenses. As a CSOT, how should you balance these findings when recommending the client's continued treatment plan and level of supervision? Option A. Maintain the current treatment intensity and supervision level solely based on the high static risk assessment score, without giving significant weight to the client's demonstrated progress in dynamic risk factors. Option B. Advocate for a treatment plan that continues to focus on managing dynamic risk factors while acknowledging the persistent influence of static risk factors, recommending a level of supervision that reflects a comprehensive risk assessment. Option C. Recommend a significant reduction in the intensity of treatment and supervision, prioritizing the recent positive changes in dynamic risk factors and deeming the static risk factors less relevant at this stage. Option D. Suggest that the client's progress in dynamic risk factors is insufficient to warrant any adjustment to the treatment plan or supervision, recommending a continuation of the most intensive interventions regardless of observed improvements. The correct answer is B. Advocate for a treatment plan that continues to focus on managing dynamic risk factors while acknowledging the persistent influence of static risk factors, recommending a level of supervision that reflects a comprehensive risk assessment. Explanation. This scenario presents a common ethical dilemma for certified sex offender treatment providers, CSOT, where the need to balance objective risk assessment with the client's progress and potential for rehabilitation creates tension. The challenge lies in accurately interpreting and applying the concepts of static and dynamic risk factors in a way that is both clinically sound and ethically responsible, adhering to the CSOT professional standards and regulatory requirements. The CSOT must navigate the inherent limitations of static factors, which are unchangeable, while recognizing the importance of dynamic factors, which can be influenced by treatment. The correct approach emphasizes a nuanced understanding of risk assessment, recognizing that, while static factors provide a baseline, dynamic factors are crucial for informing treatment planning and predicting future behavior. This approach aligns with best professional practice by prioritizing individualized treatment, ongoing assessment, and a commitment to the client's rehabilitation potential. It acknowledges that effective treatment requires adapting interventions based on changes in dynamic risk factors, thereby promoting public safety through reduced recidivism. This is ethically mandated by the principle of beneficence, acting in the client's best interest through effective treatment, and non-maleficence, avoiding harm by accurately assessing and managing risk. An incorrect approach that solely relies on static risk factors, disregarding improvements in dynamic factors, fails to acknowledge the rehabilitative potential of the client. This can lead to overly punitive or restrictive treatment plans that are not evidence-based and may hinder progress. Ethically, this approach violates the principle of justice by potentially treating individuals unfairly based on unchangeable characteristics rather than their current behavior and treatment engagement. It also fails to uphold the principle of fidelity to the client by not fully engaging in the therapeutic process of change. Another incorrect approach that overemphasizes recent positive changes in dynamic factors without adequately considering the persistent influence of static risk factors is equally problematic. This can lead to an underestimation of risk, potentially resulting in premature or inappropriate de-escalation of supervision or treatment intensity, which could compromise public safety. This approach fails to meet the ethical obligation of protecting the community, a core responsibility of the CSOT. The professional decision-making process for similar situations should involve a comprehensive risk assessment that integrates both static and dynamic factors. This includes a thorough review of the client's history, current functioning, and treatment engagement. The CSOP should continuously monitor changes in dynamic risk factors and adjust treatment plans accordingly. Ethical considerations, including the principles of beneficence, non-maleficence, justice, and fidelity, should guide all decisions. Collaboration with other professionals and adherence to established treatment protocols and ethical guidelines are essential for making informed and responsible judgments. Question 5. Examination of the data shows that a certified sex offender treatment provider, CSOT, is developing a treatment plan for an individual with a history of sexual offenses. The provider is considering various psychological theories to inform their approach. Which of the following approaches best reflects a comprehensive and ethically sound application of psychological theories in this context? Option A. Focusing primarily on the offender's current environmental stressors and immediate behavioral responses, with minimal consideration for underlying psychological dynamics or historical patterns, as these are less directly observable. Option B. Adopting a theoretical framework that is most familiar and comfortable to the provider, regardless of its specific applicability to the nuances of sexual offending or its empirical support in the field. Option C. Prioritizing a single, well-established psychological theory that offers a clear explanation for the offender's behavior, and tailoring the treatment exclusively to the tenets of that theory. Option D. Integrating insights from multiple, evidence-based psychological theories, recognizing that each offers a partial understanding, and using this synthesis to develop a nuanced, individualized treatment plan that addresses the offender's unique risk factors and needs. The correct answer is C. Prioritizing a single, well-established psychological theory that offers a clear explanation for the offender's behavior and tailoring the treatment exclusively to the tenets of that theory. Explanation. This scenario is professionally challenging because it requires the certified sex offender treatment provider, CSOT, to critically evaluate competing psychological theories of sexual offending and apply them to a complex individual case, while adhering strictly to the ethical and regulatory standards governing CSOT practice. The CSOT must move beyond a superficial understanding of theories to a nuanced application that informs effective, evidence-based treatment planning. The correct approach represents best professional practice because it demonstrates a commitment to a comprehensive, multi-theoretical understanding of sexual offending. By integrating insights from various psychological perspectives, the CSOT can develop a more robust and individualized treatment plan that addresses the multifaceted nature of sexual offending. This aligns with the ethical imperative to provide competent and effective treatment, as mandated by professional standards that emphasize the use of evidence-based practices and a thorough assessment of the individual's unique needs and risk factors. A multi-theoretical approach acknowledges that no single theory fully explains all instances of sexual offending, thus promoting a more holistic and effective intervention strategy. An incorrect approach that relies solely on a single, simplistic theory of sexual offending is professionally unacceptable. This failure represents a significant ethical lapse because it can lead to an incomplete or inaccurate assessment of the offender's needs and risk factors, potentially resulting in ineffective or even harmful treatment. For instance, a purely behavioral approach might overlook underlying cognitive distortions or emotional deficits, while a purely psychodynamic approach might neglect the impact of environmental factors or learned behaviors. Such a narrow focus violates the ethical duty to provide comprehensive care and can be seen as a failure to adhere to the principle of beneficence, acting in the best interest of the client, and non-maleficence, avoiding harm. Furthermore, it may contravene regulatory requirements for treatment providers to utilize a range of assessment tools and theoretical frameworks to inform their practice. Another incorrect approach that prioritizes theoretical dogma over empirical evidence or individual client presentation is also professionally unsound. This can lead to a misapplication of theory, where the provider attempts to force the client's presentation into a pre-existing theoretical mold, rather than allowing the theory to illuminate the client's unique experiences. This demonstrates a lack of critical thinking and an inability to adapt theoretical knowledge to the complexities of real-world cases, which is a failure of professional competence. The professional decision-making process for similar situations should involve a systematic evaluation of the client's history, presentation, and risk factors through the lens of multiple, evidence-based psychological theories. The CSOP should consider the strengths and limitations of each theory in explaining the specific aspects of the offending behavior. This involves a continuous process of assessment, intervention, and reevaluation, where theoretical understanding informs practice and clinical observations refine theoretical application. The ultimate goal is to develop a treatment plan that is not only theoretically grounded, but also empirically supported and tailored to the individual's specific needs, promoting rehabilitation and reducing recidivism, in accordance with all applicable regulations and ethical guidelines. Question 6. Performance analysis shows that the effectiveness of psychological testing and evaluation in guiding treatment for certified sex offender treatment providers is significantly influenced by the selection and application of assessment tools. Considering the regulatory framework for certified sex offender treatment providers, CSOTP, which approach to psychological testing and evaluation best optimizes the process for developing effective, individualized treatment plans. Option A. Selecting assessment tools based on their ease of administration and scoring, regardless of their specific validation for sex offender populations. Option B. Employing a comprehensive battery of psychometrically validated assessment instruments specifically designed or adapted for the sex offender population, administered and interpreted by a qualified professional, considering cultural and individual differences. Option C. Utilizing exclusively self-report questionnaires without any objective measures or collateral information to gauge the individual's perceptions of their issues. Option D. Relying primarily on a single, widely recognized personality inventory to gain a general understanding of the individual's psychological functioning. The correct answer is B. Employing a comprehensive battery of psychometrically validated assessment instruments specifically designed or adapted for the sex offender population, administered and interpreted by a qualified professional, considering cultural and individual differences. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified sex offender treatment provider, CSOTP, to navigate the complex interplay between psychological assessment, treatment planning, and the specific legal and ethical mandates governing sex offender treatment. The provider must balance the need for accurate diagnostic information with the imperative to avoid introducing bias or compromising the integrity of the evaluation process, all while adhering to strict jurisdictional regulations. The potential for misinterpretation of test results or the use of inappropriate assessment tools can have significant consequences for the individual's treatment trajectory and legal standing. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the use of psychometrically sound, validated assessment instruments, specifically designed or adapted for use with individuals who have committed sexual offenses. This aligns with the ethical guidelines and regulatory frameworks that mandate evidence-based practices in sex offender treatment. Utilizing a battery of tests that assess a range of relevant constructs, e.g., risk factors, protective factors, cognitive distortions, personality traits, sexual interests, provides a comprehensive understanding of the individual, which is crucial for developing an individualized and effective treatment plan. Furthermore, ensuring that the chosen instruments are administered and interpreted by a qualified professional, with consideration for cultural and individual differences, upholds the principles of competence and due diligence required of a CSOTP. This approach directly supports the goal of accurate risk assessment and effective intervention, as mandated by the regulatory framework. Incorrect approach is analysis. One incorrect approach involves relying solely on a single, broad personality inventory without considering its specific applicability or validation for the sex offender population. This fails to meet the regulatory requirement for specialized assessment and can lead to inaccurate conclusions about risk and treatment needs. Ethically, it demonstrates a lack of competence in specialized sex offender assessment. Another incorrect approach is the exclusive use of self-report measures without corroborating information or objective assessments. While self-report can be valuable, individuals with a history of sexual offenses may exhibit defensiveness, denial, or minimization, which can skew results. Regulatory frameworks often emphasize multi-method assessment to ensure a more robust evaluation. Ethically, this approach risks over-reliance on potentially unreliable data. A third incorrect approach is the selection of assessment tools that have not been empirically validated for use with sex offenders or that are known to be culturally insensitive. This violates the principle of using evidence-based practices and can lead to misdiagnosis and inappropriate treatment recommendations, contravening regulatory mandates for effective and equitable treatment. Ethically, it demonstrates a failure to adhere to professional standards of care and can result in harm to the individual. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the specific jurisdictional requirements for CSOT, including any approved assessment tools or methodologies. This should be followed by a review of the individuals presenting concerns and referral questions. The provider must then identify assessment instruments that are psychometrically sound, validated for the target population, and relevant to the assessment goals. A multi-method approach, incorporating various types of data, e.g., clinical interviews, collateral information, objective tests, self-report measures, is generally preferred to ensure a comprehensive and accurate evaluation. Finally, the interpretation of results must be integrated within the broader clinical context, considering individual factors and the specific legal and ethical obligations of the CSOT role. Question 7. Process analysis reveals that understanding the sociological underpinnings of sexual offending is crucial for effective treatment. Considering the impact of social learning, differential association, and strain theories, which of the following approaches best reflects a CSOT responsibility in applying these frameworks to offender assessment and intervention? Option A. Dismissing sociological theories as irrelevant, focusing solely on individual psychological deficits, and assuming that social context has no bearing on sexual offending behavior. Option B. Critically evaluating the applicability of various sociological theories to understand the environmental, interpersonal, and structural factors that may contribute to sexual offending, and integrating these insights into a comprehensive, individualized assessment and treatment plan. Option C. Applying a single, dominant sociological theory universally to all sexual offenders, assuming it provides a complete explanation for their behavior and dictates all treatment strategies. Option D. Attributing sexual offending exclusively to inherent individual pathology, disregarding any potential influence of social learning, peer dynamics, or societal pressures as contributing factors. The correct answer is B. Critically evaluating the applicability of various sociological theories to understand the environmental, interpersonal, and structural factors that may contribute to sexual offending, and integrating these insights into a comprehensive, individualized assessment and treatment plan. Explanation. Scenario analysis. This scenario presents a professional challenge in applying sociological theories to understand and treat individuals who have committed sexual offenses. The difficulty lies in moving beyond simplistic labeling to a nuanced understanding of the complex interplay of social factors that may contribute to offending behavior. A CSOT must critically evaluate theoretical frameworks, recognizing their limitations and potential biases, while remaining grounded in evidence-based practice and ethical guidelines. Challenge is to integrate theoretical knowledge with individual assessment and intervention planning in a way that promotes public safety and offender rehabilitation. Correct approach analysis. The correct approach aligns with best professional practice by acknowledging the multifaceted nature of sexual offending and the utility of sociological theories in providing a framework for understanding these complexities. It recognizes that theories like social learning, strain theory, or differential association, when applied judiciously, can illuminate pathways to offending by highlighting the roles of environmental influences, learned behaviors, and social interactions. This approach emphasizes the importance of critically evaluating these theories, understanding their specific applications to sexual offending, and integrating them into a comprehensive assessment and treatment plan that addresses individual risk factors and protective factors. This aligns with the ethical imperative to provide evidence-informed and individualized treatment, as mandated by professional standards and regulatory frameworks for CSOT, which require a thorough understanding of contributing factors to effective intervention. Incorrect approaches analysis. One incorrect approach fails by oversimplifying the etiology of sexual offending, attributing it solely to individual pathology without considering the broader social context. This ignores the foundational principles of sociological inquiry and the evidence suggesting that social and environmental factors play a significant role. Such an approach risks leading to incomplete assessments and ineffective treatment plans that do not address the full spectrum of contributing factors, potentially violating ethical obligations to provide comprehensive care and regulatory requirements for evidence-based practice. Another incorrect approach errs by uncritically accepting a single sociological theory as universally applicable to all sexual offenders. This demonstrates a lack of critical thinking and an inability to adapt theoretical frameworks to the diversity of offending behaviors and individual circumstances. Sexual offending is not monolithic, and relying on a single theoretical lens can lead to misinterpretations, misdiagnoses, and the development of treatment plans that are not tailored to the specific needs of the individual, thereby failing to meet professional standards of individualized care and potentially contravening regulatory expectations for nuanced understanding. A further incorrect approach might dismiss sociological theories altogether, focusing exclusively on individual psychological factors. While individual psychology is crucial, this stance neglects the significant body of research demonstrating the influence of social structures, peer groups, cultural norms, and environmental stressors on the development and maintenance of sexual offending. This narrow focus can lead to a superficial understanding of risk and a failure to address criminogenic needs that are rooted in social contexts, which is a deficiency in professional practice and may not meet the comprehensive assessment requirements set forth by regulatory bodies. Professional reasoning. Professionals should adopt a critical and integrative approach. This involves first understanding the core tenets of various sociological theories relevant to sexual offending. Second, they must evaluate the empirical support for each theory in the context of sexual offending, recognizing that no single theory explains all cases. Third, they should consider how these theories can inform assessment by identifying potential social risk factors and protective factors for a specific individual. Finally, theoretical insights should be integrated into the development of individualized, evidence-based treatment plans that address criminogenic needs identified through a comprehensive assessment process, always adhering to the ethical principles and regulatory guidelines governing their practice. Question 8. Analysis of how a certified sex offender treatment provider, CSOT, should best evaluate the impact of an individual's cultural background on their offending behavior, considering the need for culturally sensitive and effective treatment within the established regulatory framework. Option A. Disregard the individual's cultural background as irrelevant to the treatment of sexual offending, focusing solely on universal psychological principles. Option B. Conduct a thorough assessment that explores how the individual's cultural background may have influenced their attitudes, beliefs, and behaviors related to sexuality and power, while ensuring the assessment does not excuse or justify the offending behavior. Option C. Conclude that the individual's offending behavior is a direct product of their cultural upbringing and adjust treatment to accommodate these norms. Option D. Attribute the offending behavior to inherent cultural predispositions without further individual assessment, recommending a generalized treatment approach based on cultural stereotypes. The correct answer is B. Conduct a thorough assessment that explores how the individual's cultural background may have influenced their attitudes, beliefs, and behaviors related to sexuality and power, while ensuring the assessment does not excuse or justify the offending behavior. Explanation. This scenario is professionally challenging because it requires a certified sex offender treatment provider, CSOT, to navigate the complex interplay between an individual's cultural background and their offending behavior, while adhering strictly to the ethical and regulatory standards governing their practice. Misinterpreting or oversimplifying cultural influences can lead to ineffective treatment, reoffense, and a failure to uphold professional responsibilities. The correct approach represents best professional practice because it prioritizes a nuanced, individualized assessment that acknowledges cultural factors as potential influences without excusing or justifying the behavior. This aligns with the CSOT ethical obligation to provide evidence-based, culturally sensitive treatment. Regulatory frameworks for CSOT often mandate a comprehensive understanding of the individual, including their socio-cultural context, to develop appropriate interventions. This approach ensures that treatment is tailored to the specific needs of the client, promoting rehabilitation and public safety. An incorrect approach that attributes offending behavior solely to cultural norms fails to recognize individual agency and the complex etiology of sexual offending. This is a regulatory and ethical failure because it can lead to stereotyping, a lack of accountability for the individual's actions, and the development of ineffective or even harmful treatment plans. It violates the principle of individualized treatment and can perpetuate harmful biases. Another incorrect approach that dismisses cultural influences entirely is also professionally unacceptable. This is an ethical and regulatory failure because it ignores a potentially significant factor in an individual's life and their offending trajectory. It demonstrates a lack of cultural competence, which is often an implicit or explicit requirement for CSOT, and can result in a treatment plan that is disconnected from the client's lived experience, hindering engagement and progress. The professional decision-making process for similar situations should involve a thorough, multifaceted assessment that integrates information about the individual's cultural background with other relevant factors such as psychological, social, and developmental history. Professionals must critically evaluate how cultural norms might intersect with individual beliefs, attitudes, and behaviors related to sexual offending, always maintaining the focus on the individual's responsibility and the need for targeted intervention. This requires ongoing self-reflection, consultation with colleagues, and a commitment to continuous learning in cultural competency. Question 9. Quality control measures reveal that a certified sex offender treatment provider, CSOT, is developing treatment plans that heavily emphasize the role of specific genetic predispositions and hormonal imbalances as the primary drivers of sexual offending behavior. This approach suggests that the client's actions are largely predetermined by biological factors, with less focus on cognitive restructuring and behavioral skill development. Which of the following approaches to integrating biological theories into treatment planning is most consistent with CSOT regulatory frameworks and ethical best practices? Option A. Completely disregard all biological theories related to sexual offending, focusing exclusively on cognitive behavioral interventions and environmental factors to avoid any potential for deterministic thinking or stigmatization. Option B. Focus treatment interventions solely on managing the identified biological predispositions, such as prescribing medication or recommending specific diets, without addressing the cognitive and behavioral aspects of sexual offending. Option C. Prioritize biological explanations, such as specific genetic markers or neurological abnormalities, as the sole determinants of sexual offending, using this as the primary basis for all treatment interventions and risk management strategies. Option D. Integrate biological insights as one contributing factor within a comprehensive biopsychosocial model, focusing on how these factors may interact with psychological, social, and environmental influences to inform risk assessment and treatment, while maintaining client responsibility for behavior change. The correct answer is D. Integrate biological insights as one contributing factor within a comprehensive biopsychosocial model, focusing on how these factors may interact with psychological, social, and environmental influences to inform risk assessment and treatment, while maintaining client responsibility for behavior change. Explanation. Scenario analysis. This scenario presents a professional challenge by requiring a certified sex offender treatment provider, CSOT, to critically evaluate the application of biological theories in treatment planning. The challenge lies in balancing the scientific understanding of potential biological influences with the ethical and legal imperative to avoid deterministic thinking, ensure client autonomy, and adhere to evidence-based practices that focus on behavioral change and risk management. Misapplication of biological theories can lead to stigmatization, reduced therapeutic engagement, and potentially ineffective treatment interventions. Correct approach analysis. The correct approach represents best professional practice because it emphasizes a nuanced and integrated understanding of biological theories within the broader context of sex offender treatment. It acknowledges that while biological factors may contribute to predispositions or vulnerabilities, they do not solely determine behavior. This approach aligns with CSOT ethical guidelines and regulatory frameworks that mandate a focus on cognitive behavioral interventions, risk assessment, and the development of relapse prevention plans. By integrating biological insights with psychological, social, and environmental factors, treatment providers can develop comprehensive and individualized plans that address the multifaceted nature of sexual offending, promoting client responsibility and facilitating behavioral change. This approach respects the client's agency and avoids a deterministic view that could undermine therapeutic alliance and progress. Incorrect approaches analysis. One incorrect approach fails by overemphasizing biological determinism. This approach is professionally unacceptable because it can lead to a view where an individual's behavior is seen as an inevitable outcome of their biology, negating the role of choice, learning, and environmental influences. This violates ethical principles of client autonomy and responsibility, and it is inconsistent with regulatory requirements that focus on intervention and rehabilitation. Such an approach can also lead to inappropriate labeling and stigmatization, hindering effective treatment. Another incorrect approach is to completely disregard biological theories. While it is crucial to avoid determinism, completely ignoring potential biological contributions can be a missed opportunity for a more holistic understanding of the individual. Some biological factors, such as hormonal influences or neurological differences, may be relevant to understanding certain aspects of sexual offending and can inform treatment strategies, particularly in conjunction with other theoretical frameworks. Ignoring these potential influences may lead to incomplete assessments and less effective treatment plans, potentially failing to address all contributing factors to risk. A third incorrect approach involves relying solely on biological explanations without considering the interplay of psychological, social, and environmental factors. This is a failure to adopt a biopsychosocial model, which is generally considered best practice in mental health and offender treatment. Sexual offending is a complex phenomenon with multiple contributing factors, and reducing it to a single biological cause is an oversimplification that is unlikely to yield effective treatment outcomes or address the full spectrum of risk factors. This approach is ethically problematic as it may lead to a narrow and potentially ineffective treatment plan. Professional reasoning. Professionals should adopt a decision-making framework that prioritizes a comprehensive biopsychosocial assessment. This involves understanding the client's history, cognitive patterns, emotional regulation, social environment, and potential biological predispositions. Treatment planning should be individualized, evidence-based, and focused on behavioral change, risk management, and relapse prevention. When considering biological theories, professionals must critically evaluate the scientific literature, understand the limitations of current research, and integrate these insights cautiously into a broader treatment framework, always emphasizing client responsibility and the potential for change. Adherence to professional codes of conduct and regulatory guidelines is paramount, ensuring that treatment is ethical, effective, and promotes public safety. Question 10. System analysis indicates that a certified sex offender treatment provider, CSOT, facilitating a group therapy session, observes a pattern where several members are subtly reinforcing each other's justifications for past offenses, creating an atmosphere of shared victimhood and minimizing personal responsibility. Which of the following approaches best addresses this dynamic while adhering to CSOT regulatory frameworks? Option A. Acknowledge the shared feelings of the group members and suggest a brief break to allow for a less intense emotional atmosphere before resuming the session. Option B. Encourage the group to explore their collective feelings of being misunderstood by society, allowing them to vent their frustrations without direct challenge. Option C. Privately meet with the members exhibiting this behavior after the session to discuss their concerns individually and encourage them to be more open to the facilitator's guidance. Option D. Intervene by directly challenging the cognitive distortions and rationalizations presented by group members, redirecting the conversation to individual accountability for past actions and the development of relapse prevention strategies. The correct answer is D. Intervene by directly challenging the cognitive distortions and rationalizations presented by group members, redirecting the conversation to individual accountability for past actions and the development of relapse prevention strategies. Explanation. This scenario presents a common challenge in sex offender treatment group therapy, managing the inherent power dynamics and potential for manipulation that can arise when individuals with a history of harmful behavior interact. The professional challenge lies in creating a safe and therapeutic environment that fosters genuine accountability and change, while simultaneously preventing the group from becoming a space for collusion, minimization, or further harm. Careful judgment is required to balance the need for open communication with the imperative to maintain professional boundaries and adhere to treatment protocols. The correct approach represents best professional practice because it prioritizes a structured, evidence-based intervention that directly addresses the core issues of accountability and relapse prevention within the group setting. By focusing on the individual's responsibility for their behavior and utilizing therapeutic techniques to challenge cognitive distortions, the facilitator is actively promoting the goals of sex offender treatment as outlined by established professional guidelines. This approach ensures that the group remains a tool for positive change, rather than a platform for harmful interactions. An incorrect approach that focuses solely on the facilitator's personal feelings or attempts to impose a superficial sense of harmony, without addressing the underlying issues, would be a significant regulatory and ethical failure. This would violate the principle of providing evidence-based treatment and could inadvertently enable continued denial or minimization of problematic behaviors. Another incorrect approach that involves allowing group members to dictate the therapeutic agenda or engage in unstructured sharing without professional guidance would also be a failure. This would abdicate the facilitator's responsibility to manage the group effectively and could lead to the group becoming unsafe or unproductive, contravening ethical obligations to protect both group members and the public. Professionals should employ a decision-making framework that begins with a clear understanding of the treatment goals and the specific needs of the group members. This involves continuous assessment of group dynamics, adherence to established therapeutic modalities, and a commitment to maintaining professional boundaries. When faced with challenging group interactions, the professional should consult relevant ethical codes and treatment guidelines, seek supervision or consultation if necessary, and prioritize interventions that are evidence-based and aligned with the overarching objectives of sex offender treatment. Question 11. Research into the assessment and evaluation of individuals convicted of sex offenses, as mandated by the Certified Sex Offender Treatment Provider (CSOTP) regulatory framework, requires a practitioner to consider multiple facets of the offender's history and presentation. Which of the following assessment strategies best aligns with the principles of comprehensive evaluation and evidence-based practice for CSOTP? Option A. Employing a treatment approach that emphasizes immediate punitive consequences for any perceived noncompliance during the assessment phase, irrespective of the offender's stated treatment goals or progress. Option B. Utilizing a combination of validated actuarial risk assessment instruments, structured clinical interviews, and the systematic review of collateral information from legal and treatment records. Option C. Focusing exclusively on the offender's childhood trauma history as the sole determinant of their risk and treatment needs, without incorporating current behavioral patterns or cognitive factors. Option D. Relying primarily on the offender's self-reported account of their offenses and personal history, supplemented by a brief clinical interview focusing on current mood. Correct answer is D. Relying primarily on the offender's self-reported account of their offenses and personal history, supplemented by a brief clinical interview focusing on current mood. Explanation. This scenario presents a professional challenge because accurately assessing and evaluating sex offenders is a complex undertaking that requires a nuanced understanding of psychological, behavioral, and criminological factors. The CSOTP must navigate the ethical imperative to provide effective treatment, while also adhering to strict legal and regulatory frameworks designed to protect the public. The challenge lies in synthesizing information from various sources, identifying risk factors, and developing a treatment plan that is both evidence-based and tailored to the individual's specific needs and offense cycle, all within the confines of mandated reporting and confidentiality guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal assessment that integrates objective risk assessment tools with clinical interviews and collateral information. This aligns with regulatory requirements for thorough evaluation and evidence-based treatment planning. By utilizing validated instruments and considering the offender's history, cognitive distortions, and treatment readiness, the CSOTP can develop a robust understanding of the individual's risk and needs, which is crucial for effective intervention and public safety. This approach is ethically sound as it aims to provide the most appropriate and effective care while minimizing risk. An incorrect approach that relies solely on self-report without corroboration fails to meet regulatory standards for comprehensive assessment. It is ethically problematic because it may overlook critical risk factors or manipulative behaviors, potentially leading to an inadequate treatment plan and increased risk to the community. Another incorrect approach that focuses exclusively on a single theoretical model without considering the individual's unique presentation or incorporating objective data neglects the multifaceted nature of sex offending and the requirement for individualized treatment. This can result in a superficial assessment and a treatment plan that is unlikely to be effective, violating professional standards and potentially regulatory mandates for evidence-based practice. An approach that prioritizes punitive measures over therapeutic intervention, without a clear clinical rationale supported by assessment data, is also professionally unacceptable. It may stem from personal bias rather than objective evaluation, and fails to address the underlying factors contributing to the offending behavior, thus not fulfilling the core purpose of sex offender treatment as defined by regulatory frameworks. Professionals should employ a decision-making process that begins with a thorough review of all available client information, including legal documents, prior treatment records, and psychological evaluations. This should be followed by the administration of validated risk assessment tools and a structured clinical interview designed to explore offense-related cognitions, behaviors, and history. Collateral information from probation officers, parole agents, or other relevant parties should be sought and integrated. The assessment findings should then be synthesized to inform the development of a treatment plan that is individualized, evidence-based, and aligned with regulatory requirements for sex offender treatment. Ongoing reevaluation and adjustment of the treatment plan based on client progress and evolving risk factors are also critical components of professional practice. Question 12. Quality control measures reveal that a certified sex offender treatment provider, CSOTP, is considering several individual therapy approaches for a client with a history of sexual offenses. The client presents with significant cognitive distortions related to entitlement and a history of impulsive behavior. The CSOTP is evaluating whether to primarily utilize a treatment approach that focuses on exploring early childhood experiences and unconscious motivations, or one that emphasizes identifying and challenging maladaptive thought patterns and developing practical coping strategies for high-risk situations. Which of the following individual therapy approaches, when applied to this client, best aligns with the current regulatory framework and evidence-based practices for certified sex offender treatment providers? Option A. A humanistic approach centered on unconditional positive regard and self-actualization without specific interventions for sexual offending behavior. Option B. Cognitive behavioral therapy, CBT, approach that directly addresses distorted thinking, impulse control, and relapse prevention strategies. Option C. A supportive therapy approach that focuses on building rapport and providing emotional comfort without directly confronting problematic cognitions or behaviors. Option D. A purely psychodynamic approach focused on uncovering repressed trauma and exploring the client's early object relations. The correct answer is B. A cognitive behavioral therapy, CBT, approach that directly addresses distorted thinking, impulse control, and relapse prevention strategies. Explanation. This scenario presents a common challenge in sex offender treatment, balancing the need for evidence-based interventions with the unique and often complex needs of individuals who have committed sexual offenses. The challenge lies in selecting an individual therapy approach that is not only theoretically sound and empirically supported for this population, but also ethically permissible and aligned with the regulatory framework governing certified sex offender treatment providers, CSOTP. The CSOTP must navigate the dual mandate of public safety and offender rehabilitation, ensuring that treatment is both effective and responsible. The correct approach represents best professional practice because it prioritizes interventions that have demonstrated efficacy in reducing recidivism and addressing the underlying factors contributing to sexual offending. This involves a thorough assessment to identify specific risk factors, criminogenic needs, and strengths, which then informs the selection of a treatment modality. For example, cognitive behavioral therapy, CBT, and its derivatives, such as relapse prevention, are widely recognized as effective for this population due to their focus on identifying and modifying distorted thinking patterns, developing coping skills, and addressing problematic behaviors. Adherence to established treatment protocols and ethical guidelines, such as those mandated by the CSOTP certification body, ensures that treatment is delivered competently and responsibly, prioritizing client safety and public protection. An incorrect approach would fail to adequately consider the specific needs of the sex offender population, or would employ methods that are not supported by evidence or are ethically problematic. For instance, relying solely on psychodynamic approaches without integrating behavioral components may not effectively address the cognitive distortions and behavioral deficits crucial for preventing reoffense. Similarly, using interventions that are overly permissive or that fail to hold the individual accountable for their behavior would be a significant ethical and regulatory failure, potentially undermining public safety and the goals of treatment. Another failure would be to ignore the importance of a comprehensive risk needs responsivity assessment, leading to a misapplication of therapeutic techniques. The regulatory framework for CSOT typically emphasizes evidence-based practices and a structured approach to treatment, making any deviation from these principles a professional and ethical breach. Professionals should employ a decision-making framework that begins with a comprehensive risk needs responsivity assessment. This assessment should guide the selection of therapeutic modalities, ensuring they are evidence-based and tailored to the individual's specific profile. Continuous professional development, consultation with peers, and adherence to ethical codes and regulatory guidelines are essential for maintaining competence and ensuring the highest standard of care. The decision-making process must always prioritize public safety and the reduction of sexual offending behavior. Question 13. Operational review demonstrates that a certified sex offender treatment provider, CSOT, is working with a client whose progress in addressing problematic sexual thoughts and behaviors has significantly slowed over the past several months, with no apparent breakthroughs or substantial changes in risk factors. The CSOT is considering how to proceed, given the legal implications of treatment efficacy and ongoing supervision requirements. Which of the following represents the most appropriate course of action? Option A. Implement a novel, unproven therapeutic technique that has shown anecdotal success in other contexts, without prior consultation or formal client consent for the change. Option B. Initiate a formal reassessment of the client's treatment plan, consult with a supervisor or peer review committee, and explore evidence-based modifications to the therapeutic approach or intensity. While meticulously documenting all steps, Option C. Conclude that the client's resistance is the sole cause of the plateau and continue the current treatment plan without any adjustments or further investigation. Option D. Immediately terminate treatment due to lack of perceived progress, citing the client's inability to benefit from current interventions. Correct answer is B. Initiate a formal reassessment of the client's treatment plan, consult with a supervisor or peer review committee, and explore evidence-based modifications to the therapeutic approach or intensity while meticulously documenting all steps. Explanation. Scenario analysis. This scenario presents a common challenge for certified sex offender treatment providers, CSOT, where a client's treatment progress appears to plateau, raising questions about the efficacy of the current therapeutic approach and the potential need for modification. The professional challenge lies in balancing the client's right to appropriate treatment with the legal and ethical obligations to ensure public safety and adherence to court-ordered mandates. A CSOT must critically evaluate treatment effectiveness without prematurely concluding failure or resorting to unproven methods, all while maintaining professional boundaries and documentation standards. Correct approach analysis. The correct approach involves a systematic, evidence-based evaluation of the treatment plan and the client's engagement. This includes reviewing progress notes, reassessing risk factors, consulting with supervisors or peers, and considering modifications to the therapeutic modality or intensity based on established best practices for sex offender treatment. This approach aligns with the legal implications of treatment by ensuring that interventions are clinically sound, ethically defensible, and responsive to the client's needs and the requirements of the legal system. It prioritizes a data-driven and collaborative decision-making process, which is crucial for demonstrating due diligence and accountability in a field with significant public safety implications. Adherence to professional standards and ethical codes, such as those guiding CSOT, mandates this thorough and reflective process. Incorrect approaches analysis. One incorrect approach would be to immediately terminate treatment without a comprehensive review or consultation. This fails to meet the legal and ethical obligation to provide appropriate care and could be seen as abandoning the client, potentially leading to negative legal repercussions for the provider and increased risk to the community if the client is not adequately supported. It disregards the principle of continuity of care and the need for a structured discharge process. Another incorrect approach would be to unilaterally change the treatment modality to a highly experimental or unproven technique without sufficient research, peer consultation, or client consent. This poses significant legal and ethical risks, as it deviates from established standards of care and could be deemed negligent if it proves ineffective or harmful. It also fails to consider the client's informed consent regarding significant treatment shifts. A third incorrect approach would be to attribute the plateau solely to client resistance without exploring potential therapist-related factors or external influences. This demonstrates a lack of self-reflection and a failure to consider the dynamic nature of the therapeutic relationship, which is a core ethical principle in treatment provision. It also neglects the legal implication that treatment must be tailored to the individual's specific needs and circumstances. Professional reasoning. Professionals should employ a decision-making framework that begins with objective assessment and data collection. This involves reviewing all available information, including treatment goals, client progress, risk assessments, and any external factors impacting treatment. Next, consultation with supervisors, peers, or relevant multidisciplinary teams is essential to gain diverse perspectives and ensure adherence to best practices. Following consultation, a reasoned decision regarding treatment modification, continuation, or termination should be made, always documented meticulously. This process ensures that decisions are informed, ethical, legally sound, and focused on achieving the best possible outcomes for both the client and public safety. Question 14. Which approach would be most appropriate for a certified sex offender treatment provider, CSOT, when incorporating victim impact information into an offender's treatment plan, strictly adhering to the regulatory framework for CSOT? Option A. Omitting any mention of victim impact in the treatment plan to avoid potential emotional distress for the offender and to maintain focus solely on offender behaviors. Option B. Systematically gathering detailed victim impact statements with explicit consent, ensuring relevance to the offender's treatment goals, and maintaining strict confidentiality of all information obtained. Option C. Including all available victim impact information in the offender's file, regardless of its direct relevance to the treatment plan, to ensure a comprehensive record. Option D. Directly contacting victims to solicit their perspectives on the offender's progress, without prior consent or specific therapeutic justification. Correct answer is B. Systematically gathering detailed victim impact statements with explicit consent, ensuring relevance to the offender's treatment goals, and maintaining strict confidentiality of all information obtained. Explanation. The scenario presents a common challenge in sex offender treatment, balancing the need for comprehensive victim impact assessment with the ethical and legal obligations to protect victim privacy and avoid re-traumatization. The certified sex offender treatment provider, CSOT, must navigate these complexities while adhering strictly to the regulatory framework governing their practice. This requires a nuanced understanding of how victim impact information is to be gathered, utilized, and disclosed within the context of offender treatment. The correct approach represents best professional practice because it prioritizes a victim-centered methodology that is both ethically sound and legally compliant. This involves obtaining consent, ensuring information is relevant to treatment planning, and maintaining strict confidentiality protocols as mandated by the relevant regulatory framework. This approach respects the rights and well-being of victims while facilitating effective and responsible offender treatment. Incorrect approaches fail to uphold these critical ethical and legal standards. One incorrect approach might involve directly contacting victims without proper authorization or a clear therapeutic rationale, which constitutes a significant breach of privacy and can lead to re-traumatization, violating ethical guidelines and potentially legal statutes regarding victim protection. Another incorrect approach might involve the indiscriminate inclusion of all available victim impact information, regardless of its relevance to the offender's treatment plan. This can be overly burdensome, ethically questionable, and may not align with the specific requirements for information gathering and utilization as defined by the regulatory framework, potentially leading to misdirected treatment efforts and an unnecessary focus on details that do not contribute to offender accountability or risk reduction. A third incorrect approach might involve withholding relevant victim impact information from the treatment plan, even when it is crucial for understanding the scope of harm and developing appropriate interventions. This failure to fully acknowledge and address the impact of the offense can undermine the effectiveness of treatment and the offender's accountability. Professionals should employ a decision-making framework that begins with a thorough understanding of the applicable regulatory framework and ethical codes. This involves identifying the specific legal and ethical requirements for gathering and using victim impact information in the context of sex offender treatment. The process should then involve assessing the relevance and necessity of such information for the offender's treatment plan, ensuring all information is obtained with informed consent and through appropriate channels, and maintaining strict confidentiality. Professionals must continuously evaluate their actions against these standards to ensure they are providing responsible and ethical care. Question 15. The review process indicates that a certified sex offender treatment provider, CSOTP, is working with an individual convicted of sexual assault. During treatment sessions, the offender consistently minimizes their actions, attributing the victim's distress to misinterpretation and oversensitivity. The CSOTP is considering how to best address this dynamic to ensure effective treatment and uphold ethical obligations. Which of the following approaches most accurately reflects the CSOTP professional responsibility in understanding and addressing the impact of the sexual offense on the victim? Option A. Prioritize the offender's expressed need for treatment and progress, allowing them to frame their understanding of the offense and its impact, as long as they are engaged in the treatment process. Option B. Directly confront the offender with the victim's detailed account of their suffering, demanding an immediate admission of guilt and full emotional validation of the victim's experience as a prerequisite for any further treatment. Option C. Focus treatment on the offender's cognitive distortions and denial mechanisms, while acknowledging the victim's reported distress without further exploration of its specific impact, as the primary focus is offender rehabilitation. Option D. Gently challenge the offender's minimization by introducing factual information about the common psychological and emotional consequences experienced by victims of sexual assault, emphasizing the potential for lasting harm and the importance of acknowledging this impact for genuine accountability. The correct answer is C. Focus treatment on the offender's cognitive distortions and denial mechanisms, while acknowledging the victim's reported distress without further exploration of its specific impact, as the primary focus is offender rehabilitation. Explanation. This scenario presents a professional challenge due to the inherent complexity of addressing the multifaceted impact of sexual offenses on victims within the context of certified sex offender treatment provider, CSOTP, practice. The CSOTP must navigate the delicate balance between the offender's treatment needs and the profound, often invisible, harm inflicted upon victims. This requires a deep understanding of trauma-informed care, victimology, and the ethical obligations to avoid re-traumatization. Careful judgment is paramount to ensure that treatment interventions do not inadvertently minimize or dismiss the victim's experience, which is a core ethical and regulatory imperative. The correct approach represents best professional practice because it prioritizes a victim-centered perspective, acknowledging the lasting psychological, emotional, and social consequences of sexual offenses. This aligns with the ethical guidelines for CSOTP that mandate a comprehensive understanding of the offense's impact, not solely on the offender's pathology, but on the victim's well-being. By focusing on the victim's experience and ensuring treatment does not cause further harm, the provider upholds the principle of do no harm and demonstrates a commitment to ethical and effective treatment, which is implicitly or explicitly required by professional standards and regulatory oversight bodies governing CSOTP practice. An incorrect approach that focuses solely on the offender's denial or minimization of the offense without adequately addressing the victim's impact represents a significant regulatory and ethical failure. This approach neglects the core mandate of understanding the full scope of the offense, including its devastating effects on victims. It risks perpetuating a cycle of harm by failing to foster genuine accountability and empathy in the offender. Such a failure violates ethical principles of victim sensitivity and may contravene specific regulations that require treatment providers to acknowledge and address the harm caused to victims. Another incorrect approach that dismisses the victim's reported experience as potentially exaggerated or fabricated, without thorough and sensitive investigation, is also a critical ethical and regulatory failure. This demonstrates a lack of victim advocacy and can lead to re-traumatization. CSOTP are ethically bound to approach victim accounts with respect and to consider the potential for trauma-induced memory distortions without invalidating the victim's lived experience. This approach undermines the credibility of victims and fails to meet the professional standard of care. A professional decision-making process for similar situations should involve a systematic assessment that includes 1. Thoroughly understanding the nature and impact of the specific offense from a victim-centered perspective, drawing on victimology research and trauma-informed principles. 2. Integrating this understanding into the treatment plan for the offender ensuring accountability and empathy development. 3. Continuously evaluating the treatment process for any potential to re-traumatize or minimize victim impact. 4. Consulting with supervisors or ethics committees when complex ethical considerations arise. 5. Adhering strictly to all applicable professional codes of conduct and regulatory guidelines. Question 16. The analysis reveals a certified sex offender treatment provider, CSOTP, is treating a client who discloses specific, credible plans to re-offend against a named individual. The CSOTP has previously established a therapeutic alliance with the client, who has been compliant with treatment thus far. The CSOTP is aware of the client's history and the potential for harm. What is the most ethically and legally sound course of action for the CSOTP? Option A. Advise the client that their disclosure necessitates breaking confidentiality, and then wait for the client to decide whether to self-report or desist from their plans. Option B. Continue with the scheduled therapy session, attempting to de-escalate the client's intentions and explore the underlying issues without immediate external reporting. Option C. Consult with a supervisor and legal counsel to determine the appropriate reporting protocol, delaying any external action until a consensus is reached on the interpretation of the threat. Option D. Immediately report the threat to the named individual and relevant law enforcement agencies, while documenting the disclosure and the actions taken. The correct answer is D. Immediately report the threat to the named individual and relevant law enforcement agencies, while documenting the disclosure and the actions taken. Explanation. This scenario presents a common ethical dilemma in sex offender treatment, specifically concerning the duty to warn and protect versus maintaining client confidentiality. The challenge lies in balancing the legal and ethical obligations to protect potential victims with the therapeutic alliance and the client's right to privacy. A certified sex offender treatment provider, CSOTP, must navigate these competing interests with careful judgment, adhering strictly to the regulatory framework governing their practice. The correct approach prioritizes the safety of potential victims while respecting the client's rights within the bounds of the law. This involves a thorough assessment of the risk, consultation with supervisors or legal counsel, and adherence to mandated reporting laws. This approach represents best professional practice because it aligns with the core ethical principles of beneficence, acting in the best interest of others, including potential victims and non-maleficents, avoiding harm, as well as the legal duty to protect. It also upholds the principle of fidelity by acting responsibly and transparently within the established legal and ethical guidelines. An incorrect approach that fails to report a credible threat, despite a clear and imminent danger, violates the duty to protect and potentially exposes individuals to harm. This would be a direct contravention of mandated reporting laws and ethical codes that require action when there is a serious risk of harm. Another incorrect approach might be to immediately breach confidentiality without a thorough risk assessment or consultation, which could damage the therapeutic relationship unnecessarily and potentially violate client rights if the threat was not imminent or credible. This undermines the principle of autonomy and could lead to premature termination of treatment. A third incorrect approach, such as delaying reporting due to personal discomfort or uncertainty about the severity of the threat, demonstrates a failure in professional responsibility and a disregard for the urgency required in such situations, potentially leading to severe consequences for the potential victim and professional sanctions for the provider. Professional decision-making in such situations requires a systematic process. 1. Identify the ethical and legal obligations. 2. Conduct a comprehensive risk assessment to determine the imminence and severity of the threat. 3. Consult with supervisors, colleagues, or legal counsel to ensure informed decision-making. 4. Document all assessments, consultations, and actions taken. 5. Act in accordance with legal mandates and ethical guidelines, prioritizing the safety of potential victims. Question 17. Market research demonstrates that effective sex offender treatment requires a nuanced understanding of risk. A certified sex offender treatment provider, CSOTP, is assessing a new client who has completed a validated structured professional judgment, SBJ, risk assessment tool, yielding a moderate to high risk score. The client presents as cooperative and expresses a strong desire to engage in a less intensive treatment program than what the SBJ score might initially suggest. The CSOTP must determine the most appropriate course of action for initiating treatment. Which of the following approaches best reflects the professional and regulatory obligations of a CSOP in this situation. Option A. Prioritize the client's stated preference for a less intensive treatment program, assuming their cooperation indicates a lower actual risk, and adjust the treatment plan accordingly to enhance immediate engagement. Option B. Disregard the SBJ risk assessment tool as overly deterministic and rely exclusively on the CSOP clinical intuition and the client's current cooperative demeanor to establish the treatment plan. Option C. Rely solely on the numerical risk score generated by the SBJ tool to dictate the exact level and type of treatment, overriding any client input or clinical observations that deviate from the score's implications. Option D. Integrate the SBJ risk score with a thorough clinical evaluation of the client's specific circumstances, treatment history, and presentation to inform the development of an individualized treatment plan that addresses identified risks and protective factors, while also considering the client's expressed desire for engagement. The correct answer is D. Integrate the SBJ risk score with a thorough clinical evaluation of the client's specific circumstances, treatment history, and presentation to inform the development of an individualized treatment plan that addresses identified risks and protective factors, while also considering the client's expressed desire for engagement. Explanation: this scenario is professionally challenging because it requires a certified sex offender treatment provider, CSOT, to balance the immediate need for risk assessment with the long-term goal of effective treatment, all while adhering to strict regulatory frameworks and ethical guidelines. The core tension lies in how to interpret and apply structured professional judgment, SBJ tools, in a way that is both clinically sound and legally defensible, particularly when dealing with individuals who pose a significant risk. The CSOT must navigate the complexities of predicting future behavior, which is inherently uncertain, and translate that prediction into actionable treatment plans. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted application of SBJ. This involves not only utilizing the quantitative scores from a validated risk assessment tool, but also integrating qualitative clinical judgment, client-specific factors, and collateral information. This holistic approach aligns with the ethical mandate of providing individualized care and the regulatory requirement to base treatment decisions on thorough assessments. By considering the nuances of the individual's history, presentation, and treatment engagement, the CSOT can develop a more accurate risk profile and a more effective, tailored treatment plan. This also demonstrates due diligence in fulfilling professional responsibilities. An incorrect approach that relies solely on the numerical output of an SBJ tool fails to acknowledge the limitations of such tools and the importance of clinical expertise. This can lead to over- or underestimation of risk, potentially resulting in inappropriate treatment intensity or insufficient risk management strategies. Ethically, this is a failure to provide individualized care. Regulationally, it may be seen as a superficial application of assessment requirements, lacking the depth expected for effective sex offender treatment. Another incorrect approach that dismisses the utility of SBJ tools altogether, opting for purely intuitive judgment, is also professionally unacceptable. This ignores the scientific advancements in risk assessment and the regulatory emphasis on evidence-based practices. Intuition alone is prone to bias and lacks the transparency and accountability that SBJ tools provide. This approach risks inconsistent and potentially discriminatory decision-making, violating both ethical principles of fairness and regulatory mandates for objective assessment. A third incorrect approach that focuses exclusively on the client's stated desire for less intensive treatment, without adequately integrating risk assessment findings, is also flawed. While client engagement is important, it cannot supersede the primary responsibility of public safety and effective risk management. This approach prioritizes client preference over professional responsibility and regulatory requirements for risk-based treatment planning, potentially leading to inadequate interventions and increased risk. The professional decision-making process for similar situations should involve a systematic review of available information, including the client's history, current presentation, and the results of validated risk assessment tools. The CSOP should then engage in critical reflection, considering potential biases and the limitations of their assessment methods. This should be followed by a collaborative discussion with supervisors or peers, if appropriate, to ensure a well-reasoned and ethically sound decision. The final treatment plan should be clearly documented, justifying the rationale based on the integrated assessment findings and in compliance with all relevant regulations. Question 18. The control framework reveals that a certified sex offender treatment provider, CSOT, is working with a client who has a history of sex offenses. The client has recently relocated to a new state and is unsure about their ongoing sex offender registration requirements in this new jurisdiction. The CSOT primary responsibility is to ensure the client receives effective treatment. However, the CSOT also has a duty to consider the client's legal obligations. Which of the following actions best reflects the CSOT professional responsibility in this situation? Option A. Focus exclusively on the client's therapeutic needs, as registration is a legal matter outside the scope of sex offender treatment. Option B. Assume the registration requirements are the same as the client's previous state and instruct the client to continue reporting as they did before. Option C. Advise the client to consult with a qualified attorney specializing in sex offender registration laws to understand their specific obligations in the new state and to ensure compliance. Option D. Provide the client with a general overview of sex offender registration laws based on the CSOP understanding, without verifying the specific statutes of the new state. Correct answer is C. Advise the client to consult with a qualified attorney specializing in sex offender registration laws to understand their specific obligations in the new state and to ensure compliance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified sex offender treatment provider, CSOT, to navigate the complexities of sex offender registration laws, which vary significantly by jurisdiction and can have profound implications for client management, public safety, and the provider's ethical obligations. The CSOT must balance the client's right to privacy and rehabilitation goals with the legal mandates of registration and reporting. Misinterpreting or misapplying these laws can lead to legal repercussions for the client, the provider, and the treatment program, as well as compromise public safety. Correct approach analysis. The correct approach involves a thorough understanding of the specific sex offender registration laws applicable to the client's situation, including the relevant state statutes and any federal mandates. This includes identifying the client's specific registration requirements, e.g., duration, frequency of reporting, types of information to be disclosed, understanding the consequences of noncompliance, and integrating this knowledge into the treatment plan. Best professional practice dictates that the CSOT proactively educates the client about their legal obligations and assists them in meeting these requirements, while also maintaining appropriate professional boundaries and confidentiality within the legal framework. This approach upholds both the client's rights and the provider's ethical duty to promote public safety and adhere to legal statutes. Incorrect approaches analysis. One incorrect approach involves assuming that all sex offender registration laws are uniform across all jurisdictions and applying a generalized understanding. This is a significant regulatory and ethical failure because it ignores the specific legal landscape governing the client, potentially leading to non-compliance and legal ramifications for the client. It demonstrates a lack of due diligence and a failure to uphold the professional standard of care. Another incorrect approach is to solely focus on treatment without addressing the client's registration obligations. While treatment is paramount, neglecting the legal requirements of registration can result in the client facing legal penalties, which can impede their rehabilitation progress and reintegration into the community. This approach fails to acknowledge the interconnectedness of treatment and legal compliance in managing sex offender populations, and can be seen as a dereliction of the provider's responsibility to ensure the client is fully informed and supported in meeting all obligations. A third incorrect approach is to provide legal advice regarding registration requirements. CSOT are not licensed legal professionals and are ethically and legally prohibited from offering legal counsel. Doing so constitutes a serious ethical violation and a regulatory failure, as it exceeds the scope of their professional practice and could lead to incorrect legal guidance, with potentially severe consequences for the client. Professional reasoning. Professionals should approach this situation by first identifying the specific jurisdiction governing the client's registration obligations. This involves consulting relevant state statutes, administrative codes, and any applicable federal laws. The CSOP should then research and understand the precise requirements for the client, including the nature of the offense, the classification of the offender, and the duration and frequency of registration. This information should be clearly communicated to the client, and the treatment plan should be developed to incorporate strategies for meeting these obligations. If there is any ambiguity or complexity, the CSOTP should advise the client to seek legal counsel from a qualified attorney specializing in sex offender registration laws. Continuous professional development and staying updated on changes in relevant legislation are also crucial. Question 19. During the evaluation of a client's treatment plan, a certified sex offender treatment provider, CSOTP, is reviewing the proposed use of cognitive behavioral therapy, CBT. Which of the following applications of CBT principles is most aligned with the regulatory framework and best practices for sex offender treatment? Option A. A CBT approach that emphasizes insight-oriented exploration of early childhood experiences as the primary driver of sexual offending behavior, with less focus on current cognitive and behavioral patterns. Option B. A CBT approach that primarily utilizes relaxation techniques and stress management to address general anxiety, assuming this will indirectly reduce the likelihood of reoffending. Option C. A CBT approach that integrates risk-need responsivity (RNR) principles, focusing on identifying and modifying cognitive distortions and behavioral patterns directly linked to sexual offending, while also considering individual responsivity factors and criminogenic needs. Option D. A general CBT approach that focuses on improving overall emotional regulation and interpersonal skills, without specifically targeting the cognitive and behavioral antecedents of sexual offending. The correct answer is C. A CBT approach that integrates risk-need responsivity (RNR) principles, focusing on identifying and modifying cognitive distortions and behavioral patterns directly linked to sexual offending, while also considering individual responsivity factors and criminogenic needs. Explanation. This scenario presents a professional challenge because it requires the certified sex offender treatment provider, CSOTP, to critically assess the application of cognitive behavioral therapy, CBT, principles within the specific context of sex offender treatment, adhering strictly to the regulatory framework governing CSOTP. The core of the challenge lies in distinguishing between a generalized application of CBT and its nuanced, evidence-based adaptation for this population, ensuring that the chosen approach is both ethically sound and legally compliant with CSOTP standards. The correct approach represents best professional practice because it demonstrates an understanding that while CBT is a foundational modality, its effective application in sex offender treatment necessitates specific adaptations. These adaptations, often referred to as risk-need responsivity (RNR) principles, integrate CBT techniques with a focus on criminogenic needs, risk assessment, and individual responsivity factors. This integrated approach is supported by the regulatory framework for CSOTP, which mandates treatment that is evidence-based and demonstrably effective in reducing recidivism. Such an approach aligns with the ethical obligation to provide competent and effective care, prioritizing public safety and offender rehabilitation through methods proven to be effective for this specific population. An incorrect approach that focuses solely on general CBT principles without incorporating RNR elements fails to meet the specialized requirements of sex offender treatment. This oversight represents a regulatory failure because it deviates from the evidence-based practices mandated by CSOTP standards, potentially leading to ineffective treatment and increased risk. Ethically, it is a failure to provide competent care, as it overlooks the unique psychological and behavioral factors characteristic of individuals who have committed sexual offenses. Another incorrect approach that prioritizes symptom reduction without addressing the underlying cognitive distortions and behavioral patterns directly related to sexual offending is also professionally unacceptable. This approach is a regulatory failure because it does not target the criminogenic needs identified as crucial for reducing recidivism, as required by CSOTP guidelines. Ethically, it falls short by not providing comprehensive treatment that addresses the root causes of the offending behavior, thereby failing to adequately protect the public and promote genuine rehabilitation. A third incorrect approach that relies on a purely psychodynamic or insight-oriented model without integrating behavioral change strategies is also problematic. This is a regulatory failure as it neglects the behavioral and cognitive components that are central to effective sex offender treatment as outlined in CSOTP frameworks. Ethically, it is a failure to utilize the most effective and evidence-based modalities for this population, potentially leading to a lack of tangible progress in offender accountability and behavioral change. A professional decision-making process for similar situations should involve a thorough understanding of the CSOTP regulatory framework, including its emphasis on evidence-based practices and risk-need responsivity. Professionals must critically evaluate treatment modalities, ensuring they are not only theoretically sound, but also empirically validated for sex offender populations. This involves ongoing professional development, consultation with peers, and a commitment to adapting therapeutic techniques to meet the specific needs and risks presented by each individual, always with the dual goals of public safety and offender rehabilitation in mind. Question 20. The evaluation methodology shows that a certified sex offender treatment provider, CSOTP, is developing a community reintegration plan for an individual with a history of sex offenses. The CSOTP must select the most appropriate risk assessment approach to inform this plan, considering the need to balance public safety with the individual's rehabilitation. Which of the following approaches best aligns with current best practices and regulatory expectations for CSOTP in this jurisdiction? Option A. A comprehensive risk assessment that integrates validated actuarial risk assessment tools with clinical judgment, considering the individual's offense cycle, criminogenic needs, protective factors, and current social environmental context. Option B. A risk assessment that focuses exclusively on the legal classification of the offense and the length of the individual's prior incarceration. Option C. A risk assessment that relies solely on the static risk score generated by an actuarial tool, without further clinical interpretation or consideration of dynamic factors. Option D. A risk assessment that prioritizes the individual's expressed desire for minimal supervision, assuming this indicates low risk. The correct answer is A. A comprehensive risk assessment that integrates validated actuarial risk assessment tools with clinical judgment, considering the individual's offense cycle, criminogenic needs, protective factors, and current social environmental context. Explanation. This scenario presents a professional challenge because effective community reintegration and management of individuals with sex offenses requires a nuanced approach that balances public safety with the individual's rehabilitation needs. The CSOTP must navigate complex ethical considerations, legal mandates, and the inherent risks associated with this population. A critical aspect of this is the risk assessment methodology, which must be evidence-based and comprehensive. The correct approach represents best professional practice because it utilizes a multifaceted risk assessment that integrates actuarial tools with clinical judgment, informed by the individual's specific offense history, psychological profile, and current circumstances. This aligns with regulatory frameworks that mandate individualized treatment plans and risk management strategies. Ethical guidelines for CSOTP emphasize the importance of objective, data-driven assessments to inform interventions and supervision, thereby promoting both public safety and the potential for successful reintegration. An incorrect approach that relies solely on actuarial scores without considering clinical context fails to account for individual variability and may lead to either oversupervision or undersupervision, both of which are detrimental. This neglects the ethical imperative to provide tailored support and can violate regulations requiring individualized risk management. Another incorrect approach that focuses exclusively on the severity of past offenses without assessing current risk factors or treatment progress ignores the dynamic nature of risk and the potential for change. This can lead to stigmatization and hinder reintegration efforts, contravening the goal of rehabilitation and potentially violating ethical principles of fairness and proportionality. An approach that prioritizes punitive measures over rehabilitative interventions, even when risk is assessed as manageable, fails to acknowledge the evidence-based principles of sex offender treatment and community reintegration, potentially leading to recidivism and violating the spirit of the CSOTP role. Professionals should employ a decision-making framework that begins with a thorough understanding of the relevant CSOTP regulations and ethical codes. This framework involves 1. Identifying the individual's risk level using validated actuarial instruments. 2. Conducting a comprehensive clinical assessment to understand the individual's psychological functioning, offense-related cognitions, and protective factors. 3. integrating these findings with information about the individual's current social support, living situation, and employment prospects. 4. Developing a dynamic risk management plan that includes specific interventions, monitoring strategies, and clear criteria for adjusting supervision levels. And 5. Regularly reviewing and updating the assessment and plan based on new information and the individual's progress.